Good morning, good afternoon, good evening, and good night. Welcome to Social Value Matters 2020, our first ever online global conference. This year, Social Value International have been thrilled to work with Social Value Canada to bring you this incredible conference over 5 days. We hope that you've enjoyed both the Leadership Summits and the Practitioner Summits and have found them all interesting so far. Please note that the session today has been pre-recorded by the fantastic speakers that we have. You can enjoy watching this session, and below on the screen further down, there is a question box where you can ask questions. Please note that due to time differences, speakers will not always be able to answer your questions straight away, but please do check back because they will get back to you as soon as possible. Now, without further ado, we'll start today's session. I do hope you enjoyed the session and hope to see you soon at another one of our sessions. Thank you.
Hi, everyone. Thank you for tuning into our session. Today, we'll be talking about how we use social value to investigate the outcomes of our peer support program in Changi General Hospital here in Singapore. And I'll be talking about what peer support is, what this program does, what our journey has been, what the benefits are of such a program for an organization, why we need to do more evaluation for this program, as well as what our research was to evaluate the social impact in our organization. So let's start with talking about mental health in the workplace. So we spend a third of our lives at the workplace, and as most individuals would want, organizations as well would like to cultivate positive work experiences as it leads to increased organizational commitment, better job performance, and increased job satisfaction. This in turn keeps employees in their jobs. And what can happen though is occupational stress can often lower the organizational commitment, increase turnover, and lead to absenteeism. Now, these issues are bad for the organization, of course, because it lowers productivity and turnover rates, but the issues can lead to considerable physical and psychological problems as well for the individuals. And we know that common mental health disorders affect 70% of the workforce. So what this means is that 70% of our workforce existingly has mental health disorders or are susceptible to developing mental health disorders. And what organizations can do with this fact is to create a supportive environment for these people to seek help if they do develop these problems. And what has been of increasing interest is peer support programs, which is a prevention strategy to support each other and decrease perceived workplace stress. So how this is done is through colleagues who encourage each other to cultivate these help-seeking behaviors when emotionally distressed. So if you have colleagues that look out for you and approach you when you look like you're having a bad time, this can promote destigmatizing reaching out for professional help. So peer support established with a network of trained individuals. So these colleagues that actually render support to you or create this network of social support are actually trained in crisis intervention or mental health first aid skills that they're able to pick up on signs and symptoms of either acute stress or common mental health disorders and allow you to have some safe space to talk about your problems and possibly seek additional help. And this in turn develops resilience in people, as when they are faced with a difficult situation, they have someone who can support them to move ahead rather than ruminate on the negative effects and emotions that they're feeling. So our journey started in 2003. We had a handful of volunteers who wanted to develop a peer support program in Changi General Hospital. And in that same year, we were hit with SARS, which was obviously a very unfortunate situation and very traumatizing for the country itself, as it was something that we had never encountered before. It was new to us, and our healthcare staff were significantly affected and were going through a lot of negative emotions. So it amplified the need of a peer support program where these handful of volunteers provided brief emotional support to our distressed colleagues and that created this environment of support in the difficult time that they were facing. And the positive experience obviously resonated well with the staff, but also the management. And then we grew with more volunteers who were encouraged to join us. So we established something that we call CGH Peer Network, which is the staff's crisis management system. So rather than just a peer support program where colleagues are trained, we have a formalized structure of individuals in each division and department that can provide brief emotional support to distressed individuals and facilitate the fact that to regain their ability to cope with the problems that they're facing, and to provide psychoeducation on mental wellness and promote psychological resilience in our employees. We also would like to further grow and develop our pool of volunteers who can respond to these critical incidences. Now I'll be talking about the benefits of peer support that were quantified by this study. So in 2019, Agarwal, Brooks, and Greenberg carried out a qualitative evaluation of the experiences of 9 peer supporters who reported these benefits of the peer support program in their organization. And they said that it brought about improvements in an employee's resilience and well-being, which I have covered earlier. It's been theorized, but they also reported that they, as peer supporters themselves, perceived a higher sense of emotional awareness in their personal and professional lives, and were able to develop an increased level of sympathy for others. And this is a great finding, as not only does the peer support program benefit the people who are affected, but also people who are rendering the support. And they also felt that the program impacted the overall organization positively, as it allowed employees to promote a culture of care. And promoting this culture of care is imperative because you are providing these employees with a positive work experience. So even though they go through these difficult times that most people do, they're able to reach out to this social support network and be able to cope with the situation. Now, we think that the peer support program obviously needs more evaluation because the research validating the outcomes is limited. So we have a lot of theories about what peer support can do, but the validation of these outcomes is limited, and oftentimes the outcomes are also intangible, so it's hard to measure. So even if organizations employ this program, they're unable to, they can do qualitative assessments of the program, but that doesn't really give a visual outcome of what the program's impact has been. So we thought using social value as a tool for impact analysis would quantify the benefits of the peer support programs into monetary value so that more organizations can adopt these programs with more confidence. And we did this through our research, and my colleague Anthony will be talking about how we did that. Thank you.
Hi everyone, my name is Anthony, and in my part of the presentation, I will be sharing with you how we conduct our study, the themes we've gathered from our study, the SROI value, and last but not least, our action plans based on the outcome we've gathered. In our previous experience conducting SROI, the one challenge we faced was the part of evaluation. The concept of evaluating something intangible to a tangible product is something that many of us are not familiar with. And so to help our participants, we decided to send out a pre-survey to our colleagues, asking them what 3 items they would consider as being important to them. For this survey, we gathered a list of 30 tangible items that will be used in the value game during our interview. We also sent out an email invitation to all our peer supporters, hoping to gather their experience and perception on the benefits of peer support work. So we had 9 peer supporters who responded to us. We then conducted a 60-minute face-to-face interview with each of them using a semi-structured questionnaire. So I just want to share that when we conduct this study, we do not want to be influenced by any prior study, and therefore took on a phenomenological approach. This means that the outcome of the study is driven from the data gathered through the interview with the participants. We do not know what the participants will be sharing and do not attempt to steer the interview in a direction that is favorable to us. So some of the questions asked during the interview are, what had been the participant's experience as a peer supporter, and how had it impacted or benefited them in any way? We also asked them, how has the program impacted the person they have supported or the organization as a whole? So we understand that it is difficult to take time out just to come back for a second round of interview to validate the teams gathered and to participate in a value game. To save time, what we did was to identify teams during the interview by means of paraphrasing and reflecting what we've gathered from the conversation, and subsequently get the participants to verify the teams we've gathered. Towards the end of the interview, we asked the participants if they would like to take part in the value game, where they will attempt to peg the identified teams to the list of tangible items. And so the themes that emerged during the study regarding how the affected person has benefited from peer support includes the affected person feeling supported and helped by the peer supporters. And when the peer supporters listened intently, trying to understand what is happening to their life, to them, the affected person felt understood and acknowledged, and thus do not feel that they are alone in this. And when the peer supporters check back with the affected person sometime later after their session, they noted that they cope better in their work, they feel better in their work. Participants have also shared that there are direct positive impact to being a peer supporter. Basically, they shared that they feel a sense of satisfaction and fulfillment because they are helping people through challenging times. Participants also spoke about the gain of knowledge and skills and the feeling of confidence when they support people. Last but not least, participants also mentioned about how supporting colleagues and offering a listening ear just by listening to their story has broadened their own perspective. From the interview with the peer supporters, we've also identified what are some of the experiences that are important to the peer supporters and what do they hope that we could deliver in the future. So one of them includes having more training related to counseling skills such that they could be more effective when it comes to supporting people. Secondly, the participants hope that we could organize more activities that aims to gather the peer supporters together such that they can all socialize, share their experience and knowledge during peer support work. So we have found that the themes we've gathered is pretty similar to the 2019 qualitative study. Through the value game, we gathered from our peer supporters that they felt the peer support program is worth at least 4 times more than what we've invested in the program over a year. We also acknowledge that there may be some limitations to our evaluative study. We also acknowledge that there may be some limitations to our evaluative study. Firstly, we understand that not everyone is comfortable or have the time to do a 60-minute face-to-face interview. So participants who participated in the study may view the program as being more positive and therefore are more willing to come forward. We do hope that we can encourage other peer supporters to come forward, and then we can conduct a similar study. To do this, we're thinking of how they could share their feedback anonymously. With the information we've gathered from our peer supporters, we've come up with the following plans to improve our program. So one of them is an engagement of peer supporters through a one-on-one session. Second, we have piloted our group support session for peer supporters and are planning to run such program in the long run. Lastly, our teams are also looking into developing new courses aimed at helping our peer supporters upgrade their skills. At present, our study gathered the experience and perspective from peer supporters. We do hope to be able to conduct similar study, but to understand how the program has benefited those who have received the support. I've come to almost the end of my presentation. I do hope that our evaluative study could help provide further insight to the benefits of peer support work and encourage organizations to adopt similar practices or programs. At present, our study gathered experience and perspective from peer supporters. We do hope to conduct similar study to try to understand how the program has benefited those who have received the support. I've come to the end of my presentation, and I hope that our evaluative study could help provide further insight to the benefits of peer support work and encourage organizations to adopt similar programs or practices that will benefit the employees' well-being. If you'd like to know more about peer support work, here's a list of references that you can go to. And thank you for listening. Goodbye.
I hope you enjoyed today's session at Social Value Matters 2020. Once again, if you do have any questions for the speakers on today's session, please do ask the questions below in the box and the speakers will get back to you as soon as they possibly can. On behalf of everybody at Social Value International and Social Value Canada, I just want to thank all of the speakers for the incredible sessions that they've done today and all of you for attending. We hope that you find the rest of this week's conference as interesting as you found today, and it will see you soon at another one of the events.